Many people take it for granted that if you have health insurance, you will have better health outcomes. Let's see what the experts have to say. On the one hand, you have people such as Dr. McWilliams, who says, quote, "Recent studies have found consistently positive and often significant effects of health insurance coverage on health across a range of outcomes. In particular, significant benefits of coverage have now been robustly demonstrated for adults with acute or chronic conditions for which there are effective treatments." End quote. On the other hand, Dr. Cronick has written, quote, "Our results demonstrate that if two people are otherwise similar at baseline, but one is insured and the other is uninsured, their likelihood of survival over a 2 to 16-year follow-up period is nearly identical. These results are based on an analysis of approximately 640,000 respondents with over 5 million person years of follow-up." End quote. Similarly, Dr. Amy Finkelstein, a health economist at MIT, has written, quote, "Our results suggest that in its first 10 years, the establishment of universal health insurance for the elderly had no discernible impact on elderly mortality." End quote. She's talking here about the introduction of Medicare in the United States in the 1960s. Quote, "Our evidence suggests that part of the explanation for this finding is that prior to Medicare, elderly individuals with life-threatening, treatable health conditions sought care even if they lacked insurance, as long as they had legal access to hospitals." End quote. Doctors Levy and Miltzer do us a great service by reviewing literature here to try to see what do we actually know about whether health insurance actually has a beneficial impact on health. And here's their conclusion, quote, "Our critical review of the literature on this question suggests that when we restrict our attention to studies that convincingly address the endogeneity of health insurance, the bulk of the evidence suggests there is a small positive effect of insurance coverage on health outcomes among the populations most likely to be targets of public coverage expansions: infants, the elderly, and the poor. There is also evidence to suggest that in some cases, expansions in health insurance may not result in measurable improvements in health." End quote.